Sexually transmitted infections, STIs. Most STIs have no symptoms. A person can have an STI and not know it. If someone doesn't have symptoms, they're less likely to get tested and treated. If they don't know they have an infection, they're more likely to pass it on to someone else. How can someone get an STI? Sex, skin-to-skin contact from mother to baby, sharing certain equipment, and exchange of bodily fluids. Vaginal sex is the penetration of the vagina. Anal sex is the penetration of the anus. Oral sex is the use of your mouth on the genitals. Skin-to-skin contact includes touching and or rubbing of the private parts, and sharing equipment includes toothbrushes and razors and other equipment as well. And bodily fluids includes blood, semen, vaginal fluid, rectal mucus, and breast milk. There are 3 types of STIs: bacterial, parasitic, and viral. Bacterial STIs are caused by bacteria passed from person to person during sexual activity. There are 3 infections in this category: chlamydia, gonorrhea, and syphilis. Chlamydia is among the most common bacterial STIs in the world. Most people have no symptoms. It is passed by having unprotected oral, anal, or vaginal sex. Condoms can help prevent the spread of chlamydia during vaginal or anal sex, and condoms or dental dams can be used for protection during oral sex. A dental dam is a square piece of latex used as a barrier for oral sex. This infection can be cured with a single dose of antibiotics. However, a person can get the infection again. It is important for partners to also be tested. Possible symptoms. Males may have itching of the penis, pain while urinating, discharge from the penis, and in some cases, pain or swelling of the testicles. Approximately half of men will have no symptoms, and many will have mild symptoms. Females may have burning while urinating, vaginal discharge or a change in normal discharge, bleeding between menstrual cycles or during or after intercourse, an increase in pain during menstruation or during intercourse, abdominal or lower back pain, and occasionally it will cause fever and chills. Gonorrhea is passed by unprotected oral, anal, or vaginal sex. Condoms can help prevent the spread of gonorrhea during vaginal or anal sex, and condoms or dental dams can be used for protection during oral sex. Most people have no symptoms. The infection can be cured with antibiotics. However, a person can get the infection again, and it is important for partners to also be tested. Many women do not have symptoms. If they do, symptoms include burning during urination, rectal pain, itching, bleeding, discharge, vaginal bleeding or pain, yellowish or white vaginal discharge. Some men may have very mild symptoms or no symptoms at all. Symptoms include discharge from the penis, burning while urinating, and painful or swollen testicles. Syphilis is a rare sexually transmitted bacterial infection that can cause serious damage if it is not cured, including death. It's passed on by unprotected oral, anal, or vaginal sex. Condoms can help prevent the spread during vaginal or anal sex, and condoms or dental dams can be used for protection during oral sex. This infection can be cured by antibiotics, and a person can get this infection again. It is important for partners to also be tested. Syphilis produces a wide range of symptoms that are often confused with other illnesses, and others may have no symptoms at all. Symptoms vary depending on the stage of the infection. Primary syphilis, the first stage, is 3 days to 3 months after contact, and a painless open sore develops around the genitals, rectum, and or mouth. The sore will heal on its own, but the infection remains. Secondary syphilis, the second stage, is 2 to 24 weeks after exposure, and a rash can develop anywhere on the body, including on the palms of the hands, the soles of the feet. And flu-like symptoms develop, including headache, fever, fatigue, loss of appetite, weight loss, sore throat. And latent syphilis is the third stage, which occurs after secondary, and typically there are no symptoms. How can I be tested for syphilis, and how is syphilis treated? A blood test can be done for syphilis, and it is treated with antibiotics. And all sexual partners should be tested and or treated. Next, we talk about parasitic STIs. A parasite is an organism that lives on or in a host and gets its food from or at the expense of its host. This includes pubic lice, scabies, and trichomoniasis. For pubic lice, the lice attach their eggs to the pubic hair and feed on human blood. They spread by sexual contact. Scabies is caused by the itch mite. It burrows just under the skin and lays eggs. The scabies mite can live for 2 to 4 days away from the human body, and it's transmitted with sexual contact. Trichomoniasis is caused by a parasite that is usually sexually transmitted, but it can survive 24 hours on wet towels and bathing suits. Condoms will help prevent the spread of trichomoniasis. Pubic lice and scabies can be prevented by avoiding sharing towels and clothing that have not been washed, and when trying on bathing suits or underwear in the store, always wear something underneath. Signs and symptoms include intense itchiness, reddish rash, pain during sex or urination, and vaginal discharge. Treatment includes special shampoo, lotion, and ointments to kill lice or scabies, and antibiotics are used to treat trichomoniasis. Viral STIs include human papillomavirus, herpes, hepatitis, and HIV/AIDS. HPV is very contagious and people never get symptoms. HPV is spread through skin-to-skin contact, oral, anal, and vaginal sex with an infected partner. There are different types such as genital warts and other types that can cause cancers such as cervical cancer. HPV is not curable. Treatment options include special medication, freezing with liquid nitrogen, or laser therapy to destroy warts. One can reduce their chances of getting and spreading HPV by avoiding sex or using protection such as condoms or dental dams. There are also vaccines available. Genital herpes, caused by the herpes simplex virus, HSV. It's spread through skin-to-skin contact and oral, anal, and vaginal sex. Some people with herpes never develop sores, but are still contagious and may spread it to others without knowing. People who have an initial outbreak can have more outbreaks throughout the rest of their lives. Remember, herpes is not curable. It is treatable. Treatment options for genital herpes include letting the blisters or sores heal on their own, medication for outbreaks when they happen, and daily medication to decrease outbreaks for people who suffer from frequent outbreaks. Hepatitis, a virus that affects your liver. It can cause permanent liver disease and liver cancer. There are 3 types. Hepatitis A is transmitted through fecal-oral route. Hepatitis B is transmitted through blood and bodily fluids, and hepatitis C is transmitted mostly through blood but also through bodily fluids. Lowering your chances of hepatitis B and C. Get vaccinated against hepatitis B, which is available for students in grade 7. Practice safer sex. Do not share instruments used in body piercings, tattooing, or hair removal. Do not share personal items such as toothbrushes, razors, and needles, as they can have small amounts of blood or bodily fluids, even if you can't see them. For example, have you ever tasted a little blood after brushing and flossing but didn't see the blood on your toothbrush? HIV is the initial infection. AIDS is the advanced stage of the disease. Over a period of time, the virus attacks and damages the body's immune and nervous system. How is HIV spread? The virus is spread through bodily fluids. Decrease risk with condom use. There is no cure for HIV infection. Once infected, you have HIV for life. However, there are some treatments to slow the progression of the disease, such as antiretroviral therapy. For chlamydia and gonorrhea, urine tests for males and females. If symptoms are present, swabs may be done. Trichomoniasis is diagnosed by taking a sample of vaginal discharge. Genital warts, HPV, is diagnosed by visual examination. Herpes is usually diagnosed by sight and by history. A swab of the lesion can be taken to confirm the virus. Hepatitis B, C, syphilis, and HIV are diagnosed by blood tests. You can visit a family doctor or nurse practitioner, a walk-in clinic, or a health unit for testing. The only 100% effective way of preventing STIs and pregnancy is abstinence. Abstinence is to not do something. Sexual abstinence is to abstain from sexual activity. This includes avoiding vaginal and anal intercourse, avoiding oral genital contact, and avoiding genital contact. Preventing STIs. Delay sexual activity until you are older, and if you choose to be sexually active, use protective barriers such as condoms or dental dams. The risk of STIs increases with number of partners. If you are sexually active, get tested for STIs regularly with each new partner and ensure your partner is tested. Remember, the best protection from STIs is abstinence, and just because someone doesn't have symptoms doesn't mean they don't have an STI. Always protect yourself. If you have any questions or concerns, talk to a parent, teacher, or trusted adult.